And the Delta variant is forcing the CDC to issue a new warning tonight. If you've been exposed to COVID, you should get tested even if you are vaccinated. Crown 4's Gail Ong live for us in the newsroom tonight with more on why infectious disease experts here in the Bay Area say that is a good idea. Gail.
Well, Ken, the highly transmissible Delta variant is believed to be leading the surge in COVID cases in Bay Area counties. That's why health experts are urging people not to let your guard down.
The more people who are infectious, the more people who are walking around with infection, the more likely you are to come into contact with someone who's infectious, and the more likely it is that we'll be seeing breakthrough cases.
UCSF infectious disease specialist Dr. George Rutherford says he is already hearing about an apparent increase in testing in the wake of the COVID breakthrough cases driven by the Delta variant.
Was talking to somebody today who was down at in the Mission and said there was a long line of people wanting to get tested, most of whom were vaccinated already. They'd been exposed and were worried.
San Francisco COVID testing data shows a drop in testing since January and a slight increase as of July 21st. The city closed the main testing site on the Embarcadero in June after seeing a drop in cases and more people getting the vaccine. At this time, the city is focusing on neighborhoods with a high COVID positivity rate. Meanwhile, data in Santa Clara County shows an increase in testing. County public health officials say they plan to expand the fairgrounds testing location to 7 days a week starting July 31st. In Contra Costa County, public health officials say there are many appointments available for testing every day and may make changes in the future if demand changes. Other Bay Area counties have kept existing testing sites open. Meantime, Dr. Rutherford says following health guidelines will help rule out breakthrough cases.
Wear masks if you're in indoor public spaces. And two, if you have a known exposure, get tested with 3 to 5 days after that exposure.
And Dr. Rutherford adds, if you develop COVID symptoms, you should get tested regardless of vaccination status. In the newsroom, Gail Ong, Crown 4 News.